In this video, I want to do a case presentation on dental implants, what dental implants are, who is a candidate for a dental implant. Here's a model that we have here in the clinic. Typically, people need dental implants when they're missing a tooth or several teeth in their mouths. And we first of all end up assessing that patient to make sure that they have enough bone where they're missing that implant and that tooth, and then we look at their health, overall health. How healthy are they? Are they diabetic? Do they have any other underlying health conditions that would prevent them from getting dental implants? Once we've passed several phases of checking the patient to make sure that they're a great candidate, and then we'll make a treatment plan for that patient to come in and do the dental implant. So this is one case, this is one type of implant that I have here in the clinic. Now there are different sizes of implants. There's some that are much bigger than this. There's some that are smaller. There's some that are shorter than this, some that are longer than this. Each case is going to be different depending on what you're trying to do. Here was a case that we ended up doing an immediate implant. An immediate implant is basically where you take out the tooth in one appointment and then you place the implant that same appointment if you can justify that there's enough bone on the buccal here and then on the lingual here. Now what I like to do, in fact what I ended up doing in this particular case was I make a flap. I make an incision here and I make an incision here and I flap this out so I can see the bone really good on the buccal here and then on the lingual here, and that tells me also what size of implant I need to place in there. Once I place the implant, then I like to pack it with some bone, synthetic bone, in the crevices where there might be some areas that are not completely filled with the implant. And then we suture on top of that. Then I like to see the patient 1 week after I've placed the implant, and then 2 weeks after I've placed the implant, and then a month, and then after that we see them 6 months later after the implant is completely healed, and we start the process to be able to make a crown on top of that implant. So the implant is just a thing that goes inside of the osteotomy here, and this patient was a good candidate for that because their health was good. They are not a smoker, they don't drink, because if you do all of those things, then the likelihood that this implant is going to be a success is very, very small. So we have to just make sure that we're checking for those things before we do an implant. Here was a different view of that same case. This was after we placed the implant in this site here. Now the implant is underneath there, so you can't see that it's in there. And then there was another one that we did on this side as well. You couldn't see there. This case turned out being a very, very good case for us. The patient was happy with it, and now they've had these teeth in their mouth for a long time. They've been eating, chewing, and everything, and they don't have any problems with anything like that. In fact, they're interested in getting another one here, which we haven't just quite gotten to, but I think we're going to be able to do that for this patient here pretty soon. Here was the buccal view again. This was primarily why they came in. They didn't like the fact that when they were smiling, you could see this. Now you can replace this. You could do a bridge here, a 3-unit bridge, but this patient didn't want that. They wanted an implant, so that's what we ended up doing in that case. Here was another case that was actually done by a different dentist. They placed the implants here, and then this patient ended up coming to me to do the restoration here, these implant retained crowns. It turned out to be a really, really good case. The patient was happy with it, and we're happy that we were able to do that for that patient. Here was a case that I just finished up not too long ago here in my clinic, and you might not be able to see this clearly, but this patient was missing these 2 teeth here. They're going to come back later and get an implant here, but we did an osteotomy here, and we placed an implant. Again, I like to flap all of my surgical areas so I can see exactly where the bone is. I can see there's bone here on the buccal. I can see also on the lingual when I flap that out that I can see that. We place the implant in there, we suture it up and close it up, let the implant heal for about 4 to 6 months. The patient comes back later and we put the crown on top of that. Later, this patient is going to come back and we're going to place another one here, the same process here, and it's going to turn out to be a good case. And we've done a lot of these cases here in our clinic. So implants are very, very good things. If you're missing teeth and you need something that's going to stay in your mouth, doesn't come in and out, you can floss and brush around them just like your regular teeth. They're very, very good. They last a long time too. If they're properly done, they can last a long time for a lot of the patients that we see in our clinic. Let's see. Again, you can also do an immediate implant. Some cases you might want to, once you've done an extraction like this, you may want to let this heal out, or actually you do a bone graft first, and then you let this heal out for about 6 months, and then you come in and you place the implant later. That's the more conventional way of doing implants. But if you can justify doing an immediate implant where the patient doesn't want to go for a long time without teeth, then you can do an immediate implant. And I wouldn't suggest loading it the same appointment. I would actually let the implant heal and then coming back later to do the crown. So anyways, dental implants are just prostheses like this that we put in osteotomies like that there. And the patient comes back later and we make crowns that look like this, and the patient can smile and everything, and you pick the shade and color and they look good in a lot of the cases. So if you need one, give us a call here at Inward Dental. If you don't have any underlying health conditions like diabetes, and then if you don't smoke, if you don't drink, and you got a good bone, then we can place implants here in the dental clinic. And one of the other questions that we typically get is that do they hurt? Well, we numb you up when we're doing these implants. Once we've numbed you up, then the procedure doesn't hurt when you're completely numb. We don't put you to sleep here in my clinic. I just don't believe in sleep medicine. There's some providers out there that believe in that. Certainly I'm not one of those. We've done a lot of them with great success, and we love doing them. So if you need an implant, call us. We have very good financing options here in our clinic. If you're not able to afford all of it all at once, then you can come in and we can work out something for you. If we believe that you would be a good candidate for that, and that we can work out something together that would be beneficial for you and our clinic. So if you're missing a tooth, we don't want you going without any missing teeth. We want you to have full confidence in your life, full teeth in your teeth, in your mouth, so that you can smile, eat, chew, and do all the things that you're supposed to do and enjoy life as a human being. So if you need implants, give us a call here at Inwood Dental. We would love to help you, and we would love to help you out and your friends and family with a dental implant. Okay, thanks. Bye.